Okay, let's unpack this. Imagine having a shortcut, sort of, to understanding how countries worldwide are making smarter decisions about healthcare, especially, in places facing really unique challenges.
Hmm.
Today, we're diving deep into some fascinating material you shared from an educational forum.
That's right. This forum, it brought together global experts on value-based healthcare, VBHC,
Yep, BBHC.
and health technology assessment, HTA, and it had a real sharp focus on emerging market countries. Our mission really is to distill how these concepts can, well, forge equitable, efficient, and high-quality healthcare systems for everyone.
So let's get straight to it then. Forget just counting procedures, right? VBHC, value-based healthcare. It shifts the game entirely. It's about maximizing health outcomes that actually matter to people relative to the cost.
Exactly. It's kind of like healthcare's ultimate return on investment, if you think about it that way.
Yeah, that's a good way to put it.
And complementing VBHC is health technology assessment, HTA. Think of it as a systematic process. You have experts from different fields using clear methods to figure out, how much value a new health technology really brings.
Right.
It's all about informing those decisions, aiming for fairer, more efficient, high-quality health systems.
And applying these, well, powerful ideas to emerging markets is where it gets really compelling, isn't it?
Absolutely.
Because these aren't just like scaled down versions of developed nations. They grapple with truly unique healthcare systems, diverse patient populations.
And often, yeah, significant resource constraints. Many just don't yet have those established systems to really scrutinize the value of innovative tech when it arrives.
What's fascinating here, and the forum really highlighted this, is that value itself isn't straightforward.
Not at all. It's multifaceted. We're talking economic sustainability, ethical points, social equity, even best practices. But crucially, how value is seen really depends on who you ask.
Right, a patient versus a doctor versus a manager.
Exactly. A patient, a healthcare professional, someone managing the system, and that value for the end user, the patient, well, that's really key.
So given these complexities, these different perspectives, what practical tools did the forum actually pinpoint for decision makers on the ground?
Well, two critical tools really stood out. First, real-world evidence, or RWE.
RWE.
This is clinical evidence, but it's derived from data collected outside those neat, controlled research settings. It's like the street-level wisdom of medicine.
Okay, so here's where it gets really interesting for you listening. RWE gives insights into how treatments are actually used day to day, their benefits, their risks in real life. The discussion mentioned using RWE for biosimilars.
Yes, exactly. Biosimilars, those more affordable, near-identical versions of complex biologic drugs. RWE helps understand their value. We saw examples like data from the Danish Rheumatologic Database, DAMBO.
Oh yeah, DAMBO. I remember that example.
It demonstrates real cost savings and, importantly, confirms that switching to a biosimilar doesn't compromise efficacy or safety in the real world.
But there's always a but, isn't there?
Yes, this raises an important point. While RWE is crucial for finding those local substantive values, getting long-term results you miss in trials, we have to acknowledge it sits lower on the evidence hierarchy.
Lower. Why is that?
Well, precisely because it's so real, it's inherently messier, it's more susceptible to bias than tightly controlled studies. And, many emerging markets aren't quite set up yet to fully use RWE in decision-making. Data quality challenges, infrastructure.
That makes sense.
Though it's worth noting, countries like Kuwait are actively working on this. They're preparing their data collection infrastructure, kind of aiming to be a role model.
Okay, but that does raise a question for me. If an emerging market is already struggling with basic infrastructure, how realistic is it to expect them to build these sophisticated RWE systems? Isn't there a risk of creating even more disparity almost?
That's a very fair point. It really highlights a significant tension, and that's actually where the second tool comes in.
Oh.
Multi-criteria decision analysis, or MCDA.
MCDA.
Yeah. Now, this is an algorithm-driven tool. It's particularly valuable for how countries procure pharmaceuticals, buy medicines, especially off-patent ones. It helps them move beyond looking only at the price tag.
Beyond just price. So it helps avoid just grabbing the cheapest option, which might not actually be the best quality or value overall.
Exactly right. MCDA offers a really comprehensive evaluation framework. It looks at multiple criteria: the product itself, the manufacturer's reliability, the services they offer, and economic factors, not just cost.
So it gives a fuller picture.
Precisely.
Mm.
And this broad view helps make policy decisions much more consistent, more transparent. It can help avoid issues like, well, companies maybe not bothering to collect RWE or even cutting corners on manufacturing if the sole focus is hitting the lowest price point.
Right, okay, that makes a lot of sense. So we have these tools, RWE and MCDA, but what does this all mean for actually bridging the gaps, for getting these systems implemented?
Yeah, how do I make it happen?
The forum's findings seem pretty clear on this. Collaboration is fundamental.
Absolutely fundamental. We're talking about industry, academia, public agencies all working together through things like public-private partnerships, joint capacity building, training initiatives.
And just continuous knowledge transfer, right?
Yeah.
Adapting global frameworks, but making them fit the local context.
Exactly. It sounds like a huge undertaking, though, doesn't it?
It does.
Sometimes you have to wonder, is it even possible to apply these global frameworks without kind of losing the unique pulse of a local community?
That's the challenge. But I think this deep dive really shows us that while, yes, implementing VBHC and HTA in emerging markets is tough, the path forward identified seems clear. It involves building that infrastructure for real-world data, the RWE piece.
Upgrading existing decision systems so they look beyond just price, using things like MCDA, perhaps.
Right, exploring those algorithm-driven tools.
Lays out the steps. And if we connect this to the bigger picture, these efforts aren't just about specific countries improving their systems. They're really about ensuring healthcare systems worldwide can deliver care that's equitable, efficient, and high quality.
A global goal.
Definitely. And it really makes you wonder, doesn't it, how might these kinds of collaborative approaches, these tools like RWE and MCDA, reshape healthcare decision-making in your own context? Something to think about.